Let's talk about the first month postpartum. Breathing is what we're going to talk about first because breathing is the most primary function of our core. Whenever we say core, most of us think we're talking about the abdominal muscle, which is true, but abdominal muscle is a part of a bigger system, which is the core. For example, take this balloon. This is our core, right in the midsection. These are the abdominal muscles. These are our hip muscles. The back, the bottom is the pelvic floor muscle, which is where your baby was hanging out not too long ago. And this top is the respiratory diaphragm. Normally speaking, the respiratory diaphragm and the pelvic floor muscle, which is your bottom muscle, they move together like two trampolines in perfect harmony with every breath. And that coordination is what switches on our core. When you have recently had a baby, that alignment is thrown off because the ribs have to change, the hips have to change, and not to mention, there could be some local trauma from the birth. So what we're going to go over today is a breathing exercise. The reason you need to do that is because that will set up the very first, very non-threatening function of your core and help your brain rebuild the connection with your core. You're going to lie down on your back, on a firm surface or on your bed, wherever you feel comfortable. Your one hand is on your chest and one hand is on your belly. Close your eyes and just breathe. There's no agenda, just notice what your hands are feeling. Notice if you feel movement in this hand. Do you feel movement in the bottom hand? Are they both moving? In through your nose and out through your mouth like you're blowing on a birthday candle. As you practice a few more breaths, try to breathe in a little bit longer than the previous breath. And every time you try to slow down or breathe longer, you will notice that your hands rise with an inhale and fall towards your spine with exhale. What we want is both hands to move. So your chest should rise, your belly should rise as you inhale, your chest and belly should fall down to the spine as you exhale. Inhale through your nose, slow exhale through your mouth like you're blowing on a hot beverage. Go back to the visual cue of that balloon and now think about the bottom of the balloon. Notice if you feel any movement in your pelvic floor or in your bottom as you inhale and exhale. When you inhale, we want to experience relaxation or nothing. We do not want to experience a squeeze. And as you exhale, we're gently going to connect with those muscles by squeezing very slightly. When you're inhaling, you're not doing anything. When you're exhaling, pretend like you're gently pulling up a blueberry inside your body using the muscles of your vulva. So think about squeezing in the vaginal muscle, sort of like if you were holding back gas. When you're done exhaling, relax those muscles. When you're inhaling, you're not squeezing anything. When you're exhaling, you're very gently squeezing the pelvic muscles in the front, very slightly squeezing the pelvic muscles in the back. Keep pulling them up inside your body. Once you're done breathing out, relax those muscles. Inhale and relax. Exhale and squeeze. As you warm up into these contractions in week 2 or week 3, we want you to be able to connect with these lower abdominal muscles. In order to identify which muscle I'm talking about, take 2 hands, place them in the front of your lower belly, in front of your hips. Think about making a huff sound like you're clearing your throat. Huff. You should feel a muscle jump up in your fingers. That's the transverse abdominis. That's a deep abdominal muscle. We're going to try to see if we can switch on or activate that muscle with your exhale. We're doing the same breathing exercise we were doing. When you're inhaling, nothing is working. As you get ready to exhale, start with engaging the pelvic muscle by pretending like you're pulling up a blueberry up inside your body using the muscles of your vulva, and tighten the lower belly as if you're zipping up a really tight pair of jeans. You should feel some tension in your fingertips. Once you feel that muscle switch on, slowly release. One of the common mistakes I find is as people try to engage this lower abdominal muscle, they pull their belly button in towards their spine and push into the ground. That's the wrong muscle. The other mistake I often find is we start to use other muscles and the chest goes up as you're squeezing the belly. That would be incorrect. You should be feeling no movement in any other body part. Inhale and relax. As you exhale, start with the pelvic floor. Gently engage the lower belly. Pretend like you're zipping up a pair of pants. Keep pulling the zipper up, and you should feel some level of tension building up in the belly. If you're not feeling any tension build up, give it time. Your belly got stretched out all the way, and it's learning how to start being at this new location. Don't get discouraged. Keep practicing every day, 5 to 10 minutes. When you can feel that muscle switching on, I think you're on the right track. One of the other things I wanted to go over was, as this abdominal muscle is healing, help it heal by not doing exercises that look like this. Don't use your abdominal muscle to do things that would fold your body in the center. When you get in and out of the bed, turn to one side, use your hands and sit up like you did when you were very, very pregnant, because that muscle is still healing. Those are some of the early exercises to do in the first month postpartum.